Hey, good morning, Celeste. Have a seat. How are you doing today?
I'm doing okay. Really starting to feel better.
Well, that's great to hear. So the Effexor seems to be working for you.
Yes, I think so. It's much better than the ones we've tried in the past.
And how's your energy level been for the past couple weeks?
Well, I've been able to do a lot more than I was before I started taking it. I'm sleeping better and enjoying being with my friends again. I'm starting to feel like my old self.
That's wonderful.
Thanks. But there's one thing I'd like to talk to you about.
What's that?
Well, I'd like to quit smoking. I've started again about a year ago, and honestly, I can't afford it anymore. Plus, I notice I'm coughing a lot more. I get out of breath when I go up just a few flights of stairs. It's really upsetting me. We've done all this work to get out of the depression, and I'm feeling better. But I know I can't feel real good until I quit.
Well, first, let me congratulate you on making the decision to quit. And I'm happy to help you in any way that I can.
Thanks. But the truth is, I'm really afraid to do it. The last time I quit, my depression got worse. I'm just starting to feel good again. I don't want to backslide. That happened to me too many times for all kinds of reasons.
Well, quitting can be difficult. And you're worried about reversing the important progress you've made on your depression?
Mm-hmm.
Well, we have some strategies that I think would really work for you. For example, there's a stop smoking medication that's also an antidepressant that can be taken alongside of your Effexor. This plus some guidance in helping you with making changes in your daily routines would be a good plan. And I would like to monitor you throughout the entire quitting process, particularly keeping tabs on your depression so that you keep making progress. How does that sound?
Sounds good. But are you sure I can take those two drugs together? Seems strange to have two depression drugs at the same time.
That's a reasonable concern. I've used this combination with dozens of patients with a lot of success.
Well, okay.
This new prescription will be for bupropion. It's also called Zyban. It helps with the withdrawal symptoms and makes you more comfortable while quitting. But equally important is that you join a counseling program. Here's a number for the state's toll-free quit line. It's the same way we're treating your depression: medication and talk therapy. The counselors there have had special training in helping people to quit, and you can pick whatever time you'd like to talk with them. Or if you prefer, we can get you signed up for a local group program.
I think I prefer the quit line. It would be easier to fit into my schedule.
And I'm here to offer you any help that I can. We'll review your quitting plan every time we do a med check. And please don't hesitate to call in between appointments. How does that sound to you?
That's great. I'm sure I can do this.
Great. Well, here's the prescription. We would want you to take it for about a week before you quit. It will ensure that you get enough of the medication before your actual quit date. But go ahead and call the quit line counselors right away. Let them know that you're going to be taking the Zyban, and they'll help you to set a quit day. And in the meantime, here's a tobacco use log that you can use to track your smoking for 2 or 3 days. It'll help you to understand your smoking better and make it easier for you to make changes in times when you'd be likely to smoke. It's pretty easy to use. Each time you have a cigarette, you'll want to record what you are doing, where you are, and how you are feeling. It'll give you and your quit line counselors lots of good information to help with your quitting plan.